Hi everyone, I'm Dr. Lavenda, a board-certified dermatologist. I'm here for another video of our acne scar treatment series. This time, I'm going to talk about TCA Cross. TCA Cross stands for Chemical Reconstruction of Skin Scars. It uses a chemical solution named trichloroacetic acid. The other term for TCA Cross is the peeling method. It was described by Lee et al. Back in 2002, where he compared 65% of TCA versus 100% TCA using the cross. This treatment is ideal for small back scar and ice pick scars. On this journal, after 5 to 6 sessions, both the 65% and the 100% TCA Cross achieve a good satisfaction rate. What does TCA Cross does to the scars? The TCA Cross leads to precipitation of protein. The precipitation of protein can also be observed when you are frying an egg. So, kapag kayo ay nagpiprito po na ito. Okay. So, what it does to the skin and that, it leads to the dermis remodeling. So, parang inaayos po niya yung skin. Okay? And by stimulating collagen production. Another trial by Mir Shapuri back in 2013, where she used 70% of TCA Cross instead of the 100% TCA. This leads to 70% improvement of the acne scars after 6 sessions. Personally, if I will be asked if I use a lower concentration of TCA versus a 100% concentration, I prefer to use 70% TCA because when you use a 100% TCA, you'll need to prime your skin with bleaching cream or a whitening agent like hydroquinone 2 weeks prior to the treatment to lessen the risk of hyperpigmentation. Ibig sabihin, kailangan pa po kayong maglagay ng whitening creams para maiwasan po yung pangingitim after TCA. So for me, if I use a lower concentration, I can go right away to the treatment without the use of a bleaching cream 2 weeks before the treatment. So, wala pong masyadong preparation if we use a lower concentration of TCA. Especially we Filipinos also have skin types 4. So, medyo dark skin type po tayo. There's always a risk of hyperpigmentation in dark skin types. So, how is TCA Cross done? I personally prefer to use a sharp wooden applicator. So, in other words, it's a toothpick. Okay, I can control the amount of TCA that will be put on the skin compared if I use a syringe. Okay, where there's a risk of spill and a risk of widening the scars. Then I wait for the frosting. So when we say frosting, these are the white dots that you can see after the peeling. But there are times where you can't see frosting. So minsan wala po kayong makikita ng mga puti-puti. Okay? So why is that so? Actually, when the TCA is applied to ice pick scars that have tunnels. So ito yung may mga tunnels or yung mga scars na medyo malalim. Okay? So, how would you know that you have applied already the TCA? You will see that there's surrounding erythema. So, magpula na yung surrounding area. So, then, don't tell your dermatologist na, Doktora, ito po hindi pa nalagyan or what. Because if there's already erythema, masyado na pong mapula, we don't put again the TCA because there's always a risk of burning the skin. So, what will you experience or what will you feel during the treatment? So medyo ma-peak siya. But most of the patients tolerate the procedure. Okay, we don't put anesthesia if we will just do the TCA Cross. We can do the we can put anesthesia if the treatment is combined with lasers or subcision. Why is that so? Because TCA Cross is actually a tolerable procedure. Okay, so what are the do's and don'ts after the treatment? So don't wash your face for 12 hours, which is an overnight. So just leave it for overnight. And once the scabs or the crusting already appears, you are not allowed to pick on the scabs. So hayaan nyo lang po siya na matuklap o matanggal. And that will go away within 7 days. Some of the patients would say that after 7 days it's already gone. So it will still depend. Some will have scabs until 14 days. Okay? Then after the scabs have built up, sometimes there's erythema or medyo mapula pa rin yung skin, or pwede po siyang may chances na magkaroon ng pigmentation or pangingitim, which is actually a normal response. And the hyperpigmentation or the redness will go away in 2 to 4 weeks. Okay? So don't be bothered by this risk of getting redness or darkening of the scar, because this will go away on its own. Okay. So what are your expectations after the treatment? When will you know that your scars is improving? Most of the patient will tell that after 2 weeks they know that the scars are leveling out. But the improvement will be gradual. Hindi po siya bigla na after 1 session, the scars were gone. It's not like that. As I have mentioned in the previous studies, that most of the patients underwent 6 sessions before they can notice the improvement or before they can have a high satisfaction rate after the treatment. Most of the studies that I have mentioned a while ago noted more than 70% of improvement after 6 sessions. So I always recommend around 4 to 6 sessions. Of course, it will still depend on what type of scar that you have. Is it ice pick or box scars? But always remember that in every treatment, you will note an improvement, and the improvement will be cumulative if you finish a total of, like, let's say 4 sessions. The effect of the treatment will be cumulative. So I would say that the number of sessions is a good indicator of improvement. So kapag maraming session, mapapansin niyo po na mas malaki ang improvement. So how often do we do the treatment? So I prefer to do it every 4 to 6 weeks. Although there are studies that do it every 2 weeks, but for me, I prefer to have it done, or I prefer to wait a little longer, which is 4 to 6 weeks will be reasonable. Do I combine TCA Cross with other treatment for scars like laser, subcision? Yes, I do, because most of the patient will not just present with one type of scar. Some of them will also have problem in the skin texture. Some of them will have rolling scars. So to improve the overall texture of the skin and at the same time to have faster results, I combine it with lasers like fractional laser. I also combine it with subcision if patients have rolling scars. I also combine it with fillers if we need to give volume to the skin. So still, assessment with a dermatologist is very important before any treatment procedure related to acne scars. If I will be asked, Doktora, pwede po ba namin gawin na lang sa bahay yung treatment? Meaning, can you do this at home? Okay. Of course, there's a lot of chemical solutions that you can buy online, and some of the patients do it on their own, okay, at home. This is actually very risky, okay. Treating your scars at home is very risky, in the sense that the chemical that we use here is very concentrated, masyado po mataas, and it will give a burn, okay? Pwede pong masunog yung skin po ninyo. Pwede pong mas lalong lumala yung scars po ninyo kapag mali po yung pagkakagawa. Okay, so I prefer you don't do this at home, and this should not be done by an untrained personnel. Okay, I prefer that you consult a board-certified dermatologist from Philippine Dermatological Society. Hope you learned something from this video, and don't forget to like and subscribe from our channel, and hope to see you again next time. Thank you. Bye!